All right. All right, let's rock and roll here. Thank you.
Okay, I want to thank everybody for attending. The title of my talk is Ancillary Treatment of NTM Lung Disease. And a lot of what I'm going to be talking about is airway clearance. A lot of patients with NTM lung disease have bronchiectasis, and I'll define what bronchiectasis is. So it's useful for anybody with bronchiectasis, not just those with NTM lung disease. Um, so I want to thank Debbie Breslowski for asking me to give this talk. I haven't specifically given this particular talk before. My interest in NTM lung disease is why do some people get it and some people don't? You know, what are the major risk factors? I'm not going to be focusing on that. I'm going to be talking about what are other treatments that you can do to help your NTM, you know, to combat your NTM lung disease. Not just, and I'm not going to be really talking about antibiotics or surgery for NTM lung disease, okay? I want to thank you all as well and the NTM support group leaders and to the physical and respiratory therapists at NYU, National Jewish, and our local VA here for teaching me a lot about airway clearance and everything. You know, as physicians, oftentimes we tell people to do these um, maneuvers or treatments, and yet we really don't know how to do it. And I mean, I'm talking about myself, right? And you all who do airway clearance, many of you who do airway clearance on a daily basis, um, probably know a lot more about this than I do. And I think that if you can get away from my talk with just learning one thing that helps you, I think it would be worth it. If what I say, you know, contradicts what you were taught or what your physician says, please let me know at the end of the questions and answer period. So here's the outline of my talk. I'm going to begin by, you know, asking what is bronchiectasis and defining it, because I think it's important to know what we're dealing with so that we can combat it. And it gives you some rationale of what we're doing. What we're doing makes sense.
Ed, I'm going to just interject. Helga, are you still there? Helga?
Yes,
Okay.
yes,
Can you mute everybody?
yes.
We're
I
getting.
will. One
Thank
second
you.
so I can then unmute Dr. Cham.
Thank you. Sorry. Sorry, Ed. Go ahead. I think Ed got.
I'm clicking unmute.
Okay. There you go.
Can you hear me now?
Yes.
Okay. All right, so here's the outline of my talk. I'm going to be asking what is bronchiectasis and defining it, and where and how do we get NTM infections. And the reason why that's important is that a lot of recurrence of NTM lung disease is due to a new infection from the environment. So even if you get treated properly with antibiotics, airway clearance, do everything you're supposed to do, and everything looks great, but then a year later you get a recurrent infection, or you think it's a relapse, but it's actually a new infection. So it's really important to know where you get NTM in the environment so that you don't get repeated infections, okay? And the bulk of my talk is going to be talking about airway clearance measures. I just have one slide on nutrition and maybe 2 or 3 slides on prevention and treatment for gastroesophageal reflux, because we think that's an important mechanism of how we acquire NTM into the lungs. And I'll summarize by giving you my top 10 recommendations. Okay. So what is bronchiectasis? So here's a cartoon. Can you see my arrow okay? My cursor?
Yes, we
So
can
here's
see
a
it.
normal lung. So here's a normal lung on the right side. And you can see here's the trachea, and it divides into two main bronchi. And this is the right lung, and then this is the upper lobe, middle lobe, and lower lobe. And you can see that the airways sort of taper as you go out into periphery. It gets smaller and smaller until you get into the air sacs out in the periphery of the lung. Here's an example of bronchiectasis. You can see that it's dilated and it doesn't taper like these guys do here. So here's bronchiectasis of the right lower lobe and probably the lingular segment right there. You can see that you can imagine that mucus can accumulate here. And because the hair cells in these airways aren't working because they're destroyed, you can't clear secretions as well. And that's why you need help in terms of airway clearance measures. Okay. Okay, so bronchiectasis then is due to the weakened airway walls, due to a vicious cycle of infection, inflammation, and mucus accumulation, right? So they sort of, it creates like a vicious cycle. The more inflammation you have, the more mucus you have, and the less you're able to clear your airways, and the greater chance of getting an infection. And the infection creates more inflammation and more mucus, and it's sort of like it creates a vicious cycle. So unless the infection, whether it's bacterial, NTM, or fungal, and the inflammation are interrupted, bronchiectasis begets more bronchiectasis. So in other words, if you start with a little bit of bronchiectasis and you don't take care of that, you can develop more bronchiectasis, okay? So active measures to clear mucus will likely help not only treat the infection and inflammation that drives the development of bronchiectasis. So here's a cartoon that I drew of the orange part is sort of like a normal airway, right? It's narrow, it's relatively narrow, and there's these what I call cilia. They're described as hair cells. I think of it like a broom, you know, because they beat in one direction, and that's up. So in other words, they help clear mucus, things that you inhale that shouldn't be in your lungs. They sort of sweep it up into your trachea so that you can cough it out. So in people with bronchiectasis, these cilia are destroyed. And I've shown you here in purple an airway that is bronchiectatic. You can see I didn't draw any cilia there. And I also drew these cells, which are mucus secreting cells. And there's more of it in people with bronchiectasis. So mucus is actually a normal thing. So mucus is meant to sort of trap bacteria and pollution particles and whatever that gets into your lung. And then these cilia then sweeps the mucus up into your trachea so you can cough it out. But if you can't clear it because you have a bronchiectatic airway, your body responds to that by producing more mucus. And that gets into a vicious cycle because the mucus can be very difficult to clear by yourself, okay? And that just creates more infection and inflammation. And I sort of diagram that here. So in people with bronchiectasis, there's often these hair cells, cilia, that are dysfunctional. You accumulate a lot of mucus that predisposes you to getting airway infections, and then causing more inflammation, and then creates this sort of like a vicious cycle. Well, airway clearance can potentially help with all different aspects of it, right? So if you clear out the mucus, you can reduce the amount of inflammation that's in your airways. So mucus is made up of a lot of inflammatory cells and inflammatory molecules, plus the mucus itself. But by clearing it out, you could potentially decrease the inflammation in your lung and you feel better. And by just clearing out the mucus, which can potentially have a lot of bacteria in there, you can help treat the infection in itself as well. And obviously, you try to prevent more bronchiectasis from forming by clearing out your mucus. So that's bronchiectasis. And the reason I put this slide up there is that your doctor or your CT scan report may use other words to describe the bronchiectasis, such as varicoid bronchiectasis. And the reason why it's called that is because here's an airway. It looks like a varicose vein. Okay, that's the only reason it's called that. It looks like a varicoid bronchiectasis. And here's somebody with varicoid bronchiectasis in the right middle lobe. And this is such a common finding in people with NTM lung disease that if I see this CT scan without knowing the patient whatsoever, I would, my first diagnosis would be, boy, I wonder whether this person has NTM lung disease. Okay. And this type of bronchiectasis is known as cylindrical bronchiectasis because it's it doesn't taper, but it's not wavy like this one is. It looks more like a cylinder. And you can see that right here. Notice how this airway doesn't taper. It just looks more like a column of air. And this is known as cylindrical bronchiectasis. And cystic bronchiectasis is sort of very dilated airways that looks like cyst, looks like a bunch of grapes, if you will. And this is considered to be the most severe form of bronchiectasis, known as cystic bronchiectasis. So that's all it means if you ever see a report or your provider talk about the different types of bronchiectasis. And some people may have more than one type in themselves, okay? They're not mutually exclusive. So where and how do we get NTM infections? As I emphasize, the reason it's important is to prevent reinfection, okay? So if you already have a underlying lung condition, such as emphysema or bronchiectasis from another cause, you are predisposed to getting NTM lung infection. So it's very important to know where NTM are found so that you can avoid those conditions that predisposes you to getting exposed to NTM and therefore getting development of NTM lung disease. So it's to prevent new infection in people who are already susceptible, okay? These people who have these underlying lung condition. However, if you already have, as I mentioned at the beginning of my talk, if you already have NTM lung disease and you do everything right, you take your antibiotics, you do airway clearance, everything looks good, your culture becomes negative, but then a year later becomes positive again. You say, oh my gosh, I did everything right. How come I got the new infection again? How come I got a different NTM? Well, they found that a lot of these new infections, recurrent infection is not due to a relapse of the old infection, but it's actually due to a new infection. So this was a study done at University of Texas, Tyler by Dr. Richard Wallace, in which he looked at recurrences of, I think it was like MAC lung disease, okay? And he found that 75% of them were actually, 75% of the recurrence was actually due to a new infection, and only 25% of them was due to a relapse of the old infection. So the point being is that it's important to know where you find NTM in environments so that you can avoid them and not get a recurrence of the infection. So where do you find them? And I've just sort of summarized it here. Basically three different eco niches, I guess. They're found in soil, they're found in water, so they can be found in natural water, like I've shown here, but they can also be found in household water, right? So here's, people in the hot tub here, showering. I'll have some things to talk a little bit about showering, and from your plumbing, right? And so studies by I think Dr. Falkenham, Joe Falkenham, has shown that, when water comes out of your water treatment plant, there's very little NTM there. So the water treatment plant is actually doing a pretty good job in filtering out and sterilizing the water so that there's very little NTM that comes out of the water treatment plant. But as it gets further away from a treatment plant and closer to your home, the number of NTM in the pipes and in the water that's bringing the water to your home increases, such that the amount of NTM in your home is probably significantly higher than what's coming out of the water in the water treatment plant. In general, NTM are fairly resistant to chlorine. So chlorine can kill a lot of the regular bacteria such as E. coli that causes, diarrhea and things like that. But it doesn't kill NTM very well. And NTM doesn't need much nutrients to survive. I mean, it can survive in your shower head, right? You're not feeding it, and yet it still survives. That's quite amazing if you really think about it. And then the third place that you find NTM is biofilms. And biofilms are basically that slimy, grungy stuff that you find inside pipes, alongside swimming pools. Plaques on your teeth are basically biofilms. And the way I think of biofilms is just they're basically a lot of slimy stuff that's secreted by various types of microorganism. And they can be DNA, they can be sugar, and they can be protein molecules, where these different types of bacteria and microorganisms live. And I sort of use it, the Manhattan skyline as an analogy. So this, the buildings are sort of like the biofilm. It's the whole thing makes up the biofilm, but the buildings are sort of those molecules that make up the slimy stuff, and the people living inside the buildings are sort of the microorganisms in the biofilm. Okay, it's basically sort of like a community unto itself, very small, but still there. So what are some environmental risk factors that are associated with NTM lung disease? And a lot of these hasn't been shown to be the exact cause. That's why I termed them circumstantial evidence, right? We know that people who live in warm, humid environment appears to have greater prevalence of NTM in the environment, but also NTM lung disease. So for example, we know that in the southeast part of the United States along the Gulf Coast, that there's high prevalence of NTM in the environment, but also there's greater prevalence of NTM in the southeast part of the United States, especially Florida, Louisiana, where it's very hot and humid, etc. But it's not just the southeast, right? I mean, you can find them in Colorado too, but there's pockets that are very high. California is very high as well, probably because of its proximity to the ocean, etc. So the ocean doesn't really support NTM, most of the NTM, but it's just that it's just a very humid and more of a humid environment in general. We know that people living near bodies of water appears to have greater prevalence of NTM lung infections. Certain components of soil, such as low pH soil, especially if they're really rich in organic matter, it's like, for example, the southeast part of the United States, they're very rich in NTM in those environments. And I think there was a study probably by Dr. Joe Falkenham showing that households with their hot water temperature set at less than 125 degrees have a greater prevalence for NTM. So the opposite would be that if it's greater than 125 degrees, it's have a lower risk of getting NTM lung infection in those people in those households. So how do we get NTM into our lungs? We know that it's in those type of environment. Well, basically two ways, right? You inhale it. You can inhale aerosolized water, aerosolized soil, and even aerosolized biofilms. And I've shown here, there's a lot of splashing. So they've traced NTM, for example, to lifeguards in swimming pools. And people who do a lot of gardening that stir up the soil, and people who use hot tub because there's a lot of agitation of the water, bubbling of the water, which can create aerosolized water that contains NTM that you can inhale in. Another way of getting NTM is if you aspirate it. So it's, NTM is in water. Because it's in water, it's in our foods. It can colonize your oral pharynx, and you can swallow it. And that's fine if you swallow it, but then sometimes if you have swallowing difficulty such that some of the secretions of what you swallow goes into your lung, or if you have reflux, some of the contents in the stomach that you swallow from your mouth goes back up and then back into your lungs, you can seed your lungs from the sort of the upper airways here, or the or from gastric reflux. Okay. So as I mentioned, you should probably not garden, and there's a study showing that NTM has been that a person has in their lung disease has been traced to even potting soil. So even indoor gardening can be potentially hazardous. And I would even venture to say that maybe indoor gardening may be even more riskier, because outdoor, you have a lot of air, there's a lot of environment, air exchange, right? Whereas indoor, you're sort of in a confined space. And therefore, if you stir up the soil and you have aerosolized soil, it's more likely to linger for longer periods of time. So we recommend that if you have bronchiectasis or you do have NTM lung disease, that you avoid gardening. But a lot of people love gardening. So things that you can do to minimize your risk of getting exposed to NTM when you're gardening, or you could wet down the soil first to lessen the aerosol before digging into it. Avoid gardening on windy days, avoid mowing lawns because it really stirs things up. And if you want to pot plants, do it outside on non-windy days. And if the exposure is significant or you're concerned, you can always wear these N95 masks. But as you all know, they're very difficult to wear, especially if it's in a hot environment outside. And you can't, even inside in an air-conditioned environment, you can't wear these masks for a very long time. So it's sort of, you can try it, but it's not easy to do. So despite some controversy, people talk a lot about shower heads, well, is shower heads the cause for my NTM lung infection? Well, unless it's been actually studied in your shower head and we can trace the bacteria to the same type of bacteria that's found in your lungs, it's hard to know, right? But it sort of makes sense. We know that you can isolate NTM from the shower heads. And because, we all use chlorinated water, right, from the municipal water treatment plants, it kills off all the other regular bacteria, and therefore it allows the NTM to actually proliferate. And there's a couple of studies showing that NTM is probably the most common bacteria that you find in shower heads. And when you turn on the shower heads, it can cause aerosolization of water. So that's a potential mechanism of how it can be inhaled into the lungs as well. So I really think that it really could be a potential source, and it's something that you don't want to take a chance on. So what can you do to minimize acquiring NTM from showering? It's inconvenient to take baths, because it is. So a lot of people are still going to be doing showering instead of taking baths. Well, so these are 6 things that you can do to try to minimize your risk of acquiring NTM from shower, okay? So first thing you could do is use shower heads with large flow and avoid the ones with fine mist. So this one right here is those types of shower heads to try to save water, right? So it has incredibly fine mist. And as you can imagine, you can create very small aerosols from this type of shower head. And these small aerosols can then be potentially inhaled into the lungs. If it contains NTM, it can cause NTM infection in the lung. Whereas if you use on the other spectrum, this type of shower heads look more like a waterfall, right? It's not going to generate the fine aerosols that this one will. And obviously you have different types of shower heads in between. And as I sort of alluded to, Joe Falkenham recommends that you set your hot water heater temperature to 130 degrees. And I know Rachel Thompson in Australia, she's an NTM doctor. She recommends 140 degrees in Australia. And obviously, you have to be careful of scalding, especially if there's young children at home. The other thing you could do is turn on the exhaust fan of your bathroom. And if possible, depending on the climate, open the window, because then you have more air coming in, right? And you can get rid of those fine mist that's created by the shower. So anything you can do to lessen your risk of exposure to these fine mists, you'll lessen the chance of inhaling those things in there. And the recommendation, again, by Joe Falkenham is to turn on the shower. And we all do that, we wait for the hot water to come on, right? So, but leave the room for 2 to 4 minutes, because they think that, because the shower head accumulates some water, right? And the thought is that when you first turn on the shower head, that's when the greatest amount of NTM that's coming out is at the beginning. So if you can turn on the fan, leave the room for a couple of minutes, and then come back in, you potentially lessen your risk of that. And if your shower head is getting gunky, or you should do it routinely, is to soak it in bleach for 30 minutes, brush it. If there's a lot of those grime that accumulates, that's biofilm too. It's hard biofilm, but it's still biofilm. And small pieces of those can break off. And not only that, but it can also be a home for the NTM as well. And if the shower head gets to be really gnarly, you may want to replace it too, as well. And get the kind that that produces more of a big droplet or a waterfall type effect. I think the hot water heater, and I got this idea from Dr. Leah Landy. She's a pulmonologist in Pennsylvania, and she's published some very nice articles. And I think the hot water heater is also a potential source for your NTM. And I'll just give you my own personal experience with the hot water heater in my home. A number of years ago, probably 10 years ago now, my hot water heater went out, and called a plumber in. He took the hot water heater out into the yard and turned on that spigot at the bottom of it. And this goopy, gelatinous, sort of like colored material sort of trickled out of the bottom of the hot water heater. It was just a slimy, almost like gelatin material that came out. That's biofilm. That's, I'm sure, teeming with tons of bacteria. And the plumber said to me, he says, how frequently do you flush your hot water heater? And I said, oh, you're supposed to flush your hot water heater? He says, yeah, apparently that's the recommendation, either every year or every 2 years. And as you can imagine, the hot water heater, because things settle down, just like anything that's sort of in standing water, you're going to develop a lot of potential organisms that can grow in there, okay? And so these are examples that I just got from the internet of people's hot water heater, the things that come out of there, right? I mean, like, look at this one. I mean, it's a lot of material that's been accumulating over years. And this is the stuff that sort of came out of my hot water heater, this, gelatinous material. And I can guarantee you that's probably teeming with bacteria, and probably a lot of it is NTM. And so I think the hot water heater is a major source for NTM infection. I think people should flush their hot water heater every year, every 2 years. If old, replace it. And as I previously mentioned, set the temperature to 130 to 140 degrees, because it's more likely to kill the NTM than if it's less than 125 degrees. So talk about airway clearance measures, okay? So again, I'm not an expert in this. Find a physical or respiratory therapist who knows a lot about this, and they can teach you, one-on-one, and how to best use some of these devices. I look on them as like tools, right? And then, it may work for, one tool may work for one person, another tool will work better for another person. So find out what works best for you. And in red here is what I'm going to be sort of giving a little bit more detail. Talk a little bit about pursed lip breathing, why that's important. Talk a little bit about huff cough, why that's important. There's two types of breathing techniques that I learned from this respiratory therapist at NYU. One is, and these names are sort of, they're not intuitive names, you know, but I wanted to give them to you simply because the respiratory therapist or your doctor may mention it, so at least you know what it is. One is known as autogenic drainage technique. And it's basically, and I'll go in more details with it, but it's basically relaxed breathing at different lung size breaths, okay? The other one is known as active cycle of breathing technique. So two different types of breathing techniques that you can do on your own to try to help clear secretions from your airways, okay? So these don't require any devices whatsoever, just yourself. However, there are devices that are available from your healthcare provider, probably from the internet as well, that you can get to try to help clear secretions. One is more of an older type. It's called positive expiratory pressure devices or PEP devices. It's basically, it's a device that you blow into and basically creates sort of like a back pressure because there's resistance to what you're blowing into, okay? It's basically like pursed lip breathing using a device. The other type that's most everybody is using now is known as oscillatory PEP devices. So they not only create a back pressure by blowing out against a resistance, but they have a mechanism such that they're sort of vibrating your airways when you're blowing out, okay? Not only resistance, but vibrating the airways. I'll just mention in passing the lung flute. I've never seen one of these, but I've heard people using it. And obviously the vibratory vest, right? There's many different types of vibratory vests. And I'm not gonna be really talking about it because I'm not an expert in that. And I'll just mention one quick slide on postural drainage, which you can combine with some of these devices as well to try to help clear up the secretions. So pursed lip breathing, okay, so you inhale in through your nose and you exhale through your mouth through pursed lip. So I'll just sort of show it to you. So it's basically you're pursing your lips rather than like this, because it creates some resistance to breathing. And by creating resistance, it sort of stents your airways open. And by stenting your airway open, it can help obviously open up your airways, but also help clear up the mucus that's in there, okay? The other technique that you all probably know already is known as the huff cough. And when I learned this, actually, I find it very helpful whenever I have a cold or something and I have some secretions down in my, lower bronchial tubes, that it actually does help bring up the phlegm. And then, whenever I have a cold, I do it in the shower because, it's moist in there and helps bring things up. But basically, how normally a cough is like this. It's more of a throaty cough, right? The throat, what you're trying to expel is from your upper airways, and from your throat. But a huff cough is, so you take a breath in, and then you, with your mouth open, sort of make sort of like a HA sound, a ha sound. A good example of this is like you're trying to fog a mirror in your bathroom, like. So let me just go through this. And you could do it at different lung volumes, different size breaths. And apparently, if you do it at low lung volumes, it helps bring up the phlegm from the peripheral airways to the more central airways. And if you do it with large lung volumes, it helps bring the secretions from your large airways back up into your throat area. So let me do it again. And the best way to remember this is as if you're fogging a mirror, okay? And I have down here a YouTube video of this lady doing a huff cough. It's only 51 seconds long, but you can watch it and, you know, a picture is worth 1,000 words type of a thing. So this is a very effective way of bringing up phlegm or secretions from your airways. Even better, and then so you often want to combine the huff cough with the regular type of cough, which is known as the active cough. So after doing the huff cough, sometimes you can feel the secretions or hear the secretions in your airways. Then you then you do the regular cough to try to bring it up. Okay, so oftentimes the huff cough is followed by the active cough, the regular cough. So this one type of breathing technique is known as autogenic drainage technique. It's basically relaxed breathing through open mouth, okay, in 3 different phases. The first phase is with small breaths. And when you feel the secretions or hear the secretions sort of in your airways, you know, it's hard to describe, but you can sort of feel it that, oh my gosh, there's something coming up here. Then go to a higher size breaths, okay? And the recommendation is that try to suppress the cough during these first 2 phases. I mean, sometimes you can't help it. You know, if you feel like there's something coming up and you can't suppress it, just go ahead and bring it up. But the recommendation is to start out with small breaths, easy breaths, and then medium-sized breaths. And then when you feel the secretions or hear the secretions coming up, take really large breaths in and out, easy breaths. And then when you feel the secretions, then do the huff cough and the active cough to bring up the mucus, okay? So let me just go through this so that you can sort of see what I'm trying to say here. And if what I'm saying is wrong or I'm doing it wrong, please tell me, okay? So I'm gonna do the first phase first, small breaths. I was told by the respiratory therapist that for this one, don't do it with pursed lip breathing. So small breaths. Okay, so I can feel the secretions coming up a little bit. I try to suppress the cough. Then I take the medium breaths. And then I feel secretions. Then I take large breaths. And then when I feel that, then I do the huff cough. And then I do the active cough. And then cough it up. And then just go through it several times. Okay, so this is known as the autogenic drainage technique. The one that's a little more complicated but similar, again, they have these names that are just not intuitive. But the reason I mention it is because the respiratory therapist is going to mention it, your doctors may mention it, is known as the active cycle breathing technique. Again, these 2 breathing techniques are similar, but they're different enough that but they're both trying to help bring up sputum on your own without any devices, okay? So compared to the previous one, when you exhale in this one, you do it through pursed lip breathing, okay? This is taught to me by the respiratory therapist at NYU. And what he told me was to do shallow breaths, for example, 8 to 10 shallow breaths. And then when you exhale, go through with the pursed lip breathing. So, and then after you do the 8 to 10 shallow breath through pursed lip breathing, then you do a few slow, deep breaths. And you repeat that until you feel like there's sputum in your airways. Then you do the huff cough, then you do the active cough. So you sort of see a pattern here. I mean, you don't have to follow it exactly, but basically you do breathing exercises. Then you do, when you feel sensation of secretions in your airway, do the huff cough, and then do the active cough, okay? I'll just go through one cycle of it. So I'm going to take 10 of the shallow breaths through pursed lip breathing, and then 5 slow deep breaths. And then I'll do the huff cough and then the active cough. Here we go. Notice I'm doing through pursed lips this time. So I just did 10 shallow breaths through pursed lips, and I'm going to do 5 deep breaths through pursed lips. Now, if I feel that there's secretions there, then I go ahead and do huff cough and then the active cough. If I don't feel like there's secretions there, then I go keep doing it, this cycle here. So I just did 1 cycle, and they say that if after 5 cycles you still don't feel like there's secretions there, then just go ahead and do the huff cough, okay? And then the active cough. And so all this right here would be 1 session, okay? And the recommendation is, you know, start off with like 2 sessions, twice a day. You know, best time to do it is probably, you know, a few hours before going to bed, so your airways can be clear when you go to bed, so you have a good night rest. And then do it the first thing in the morning. And sometimes you can work your way up to like 4 sessions a day, so space it out a little bit. So those are the 2 breathing techniques that you can do to help bring up secretions. And so I sort of give you an example of positive expiratory pressure. So basically, this is breathing out against a resistance. So if you don't have any devices, you can do that through pursed lip breathing. This basically creates a back pressure, so it stents your airways open. As you can imagine, if you stent your airway open, you're more likely to potentially disrupt any mucus that's sort of adhered to the airways, and you have increased airflow by doing that as well, and therefore you could help break up the mucus on your own. So pursed lip breathing is a form of positive expiratory pressure. Many years ago, I had a VA patient who says, you know, I find that my breathing is so much better when I blow into a balloon. And that's probably what that is, right? It's basically breathing against a resistance, right? And then obviously, if you want to be more up to date, then you can use these OPEP or PEP devices. And here's a cappella choice that this gentleman is using. And he's blowing against it to create airways resistance so that he stents his airway open to disrupt the mucus in the airway. So these are sort of, I don't know how commonly they're used now, but these are positive expiratory pressure devices that does not have the oscillatory component to it. It doesn't have the vibratory component to it. These are definitely older devices than the ones like the A Cappella and the A Replica that has the oscillatory component to it. So here's a young kid who's using a PEP device. So he's blowing against it, and you can set different pressure through a mask, or you can use it through mouthpieces as well. And you basically breathe in through your nose, breathe out through these devices, and you can set the pressure as I mentioned here. And in general, you want to use these devices such that you can exhale comfortably for 2 to 3 seconds, okay? You want the expiratory component to be longer than the inspiratory component, okay? What you inhale should be shorter. The time that you exhale should be longer, like this. And as I mentioned, you could set different pressure on that. Like what I did with the breathing technique, after doing this for 10 to 20 times with these devices, do the huff cough and then the strong active cough to clear the phlegm. Now, what's more commonly used now are these oscillatory PEP devices. So they not only create positive expiratory pressure, but they help oscillate or vibrate your airways. So if I look into your airways while you're using one of these devices, while you're blowing out through one of these devices, your airway walls is sort of shaking like this to try to beat the phlegm out of there. Okay, try to loosen the phlegm. And I've shown you two of the older forms of acapella, the low flow and the outflow. Debbie tells me that both of these are outdated now. I think people are using less and less of this. The newer form of the acapella is known as acapella choice. I think you can still set different pressure on it. One thing nice about the acapella choice is that you can take it apart more and clean it. And it can also be used with a nebulizer as well.
And
You know, national
adapted piece on that to do it? Were you able
Pardon?
to? I think you need an adaptive piece that doesn't come with it.
Oh, okay. I did not know that. Thank you. To use with the nebulizer, Debbie?
Yes.
Okay, okay. You know, many years ago, National Jewish used a OPEP device known as the flutter valve. That was the brand name flutter valve. And that was like a very simple device. And we don't use that anymore. And that device you can only use with you sitting up. You can't do it when you're lying down or, you know, on your side or anything like that, only sitting up. Then they moved into the acapella. And one thing nice about the acapella is that you could use it in different position. So some people, excuse me, let me just silence this. So some people find that when they use these devices, that it helps to do it in different position, you know, like sitting up, maybe lying down, sitting up, lying down, etc. And the acapella allows you to do it in different positions. And as I mentioned, the acapella choice is the newer model of it, and it can be used with a nebulizer. And as Debbie said, need an adapter, specific adapter for that. What National Jewish is exclusively using now is the A Replica. And I actually got one from National Jewish to experiment with, and I can sort of go through it with you. But you know, you all have actually used this multiple times, or many of you have, and so know a lot more about it than I do. But it helps me to go through it too, so that way I can teach patients on how to use it. And one thing nice about the A Replica, oh geez. And one thing nice about the A Replica is that it can, there's a manometer, so a pressure gauge that you can see how hard you're blowing, okay? And the recommendation is that you keep it between 10 to 20 centimeters of water pressure. So you can gauge yourself, are you blowing the right amount? You know, you don't want to blow too little, but you don't want to blow too much either. Again, one thing nice about the A Replica is that you can connect a nebulizer with it too. So while you're blowing into it, you can have nebulized hypertonic saline, nebulized albuterol, a bronchodilator at the same time. And as you can imagine, if you have nebulized saline going through your airways while you're vibrating it, it can help moisten the airways, which can help loosen up even more, okay? And you can sort of kill two birds with one stone, right? In terms of time efficiency as well. So let me go through how you use the A Replica, and I'll sort of just show you what I've learned from it, okay? As I mentioned, it comes with a manometer, a pressure gauge, which gauges whether your exhalation is adequate or not. It contains a green zone, which is, 5 to 20 centimeters of water, a yellow zone, which is 20 to 40 centimeters of water, and a red zone, 40 to 60 centimeters of water. So if you're breathing sort of moderately, it's sort of the amount of pressure you generate by exhalation is going to be in the green zone. If you force it out a little harder, it could go into the yellow zone, 20 to 40 centimeter. And if you're really pushing very hard, then it could go into the 40, 60 zone. The recommendation is to keep it within the green zone, okay? And As I mentioned, it can be used with a nebulizer as well. So if you look at the instruction for the Aerobica, and I did, they say to take a breath through the mouthpiece. But the Francisco, the respiratory therapist at NYU, told me that his recommendation is to take the breath without the mouthpiece in your mouth. The reason he said is that maybe there's some secretions in the mouthpiece that you could potentially be inhaling in. There could be some bacteria in the mouthpiece that you could be potentially inhaling in. So you take a breath in, hold for 2 to 3 seconds, seal the lips around the mouthpiece, and then actively exhale. So in other words, what is it? Not super forcefully, but keep your cheeks in until the sound ceases. And the recommendation is do it for about 2 to 4 seconds as well. And then you repeat that cycle 10 times. And then certainly whenever you feel, like before, whenever you feel secretions in your airways, do the huff cough and then the big active cough to bring it up. And you keep doing that, for 10 to 20 minutes, and that equals 1 session, okay? And the recommendation, like before, is to start off with 2 sessions per day and work your way up to 2, 3, 4 sessions a day. So let me go and do this right now. Yes.
So
Yeah.
if you're doing that and you're not connected to the nebulizer, definitely you should take your lips off the device. However, if you are connected to the nebulizer and you're doing it at the same time, you can't do that because you need to inhale the saline. But
Right.
Some of the physicians have said that there's some sort of protective, possibly some protective value of inhaling saline that might counteract the bacteria that you might be inhaling.
Yeah, no, that's a very good point. I think what I just said about inhaling with the mouthpiece off applies to when you don't have the nebulizer. Thank you for saying that, Debbie, because it makes sense, right? If you have the nebulizer and you want the saline to go into your lungs, you should be inhaling it through the mouthpiece if there's a nebulizer on board. No, absolutely. Okay, so I'm going to do it as if, so I'm going to do this as if the nebulizer is there, okay? Assuming the nebulizer is there. So I'm going to be inhaling through the mouthpiece, okay? I think even if the nebulizer wasn't there and you inhale through the mouthpiece, which is what the manufacturer recommends. I don't think it's a big deal. So to inhale through the mouthpiece. It's not easy, it's not easy to do this because you wanted to do it for, 2 to 4 seconds of exhalation. And that's seems like a long time when you're actually doing it. So you guys can see the manometer, the green, the yellow, and the red there. So you want the diaphragm to move into the green zone. Okay, so I do it for 10 times. That's hard work. I tend to, and then after doing 10 times, do 3 huff coughs and then the big active cough, okay? And you go through that cycle 10 times, huff cough, active cough, 10 times, huff cough, active cough, for total of 10 to 20 minutes, whatever you can tolerate. And for all these things, if you're just starting out, start out slow, start out brief, and then work your way up. Don't try to be a hero and go for the maximum at the very beginning. And so that's 1 session if you do it for 10 to 20 minutes. And again, the recommendation is 2 to 4 sessions a day. So I had a slide for the acapella, but it's basically the same thing. Okay, it's not as fancy. It doesn't have a manometer, but you can. Oh, by the way, you can set. I forgot to mention, is that you can set resistance with both the A Replica as well as the acapella, okay? And I would just start off sort of like the least amount of resistance. And the recommendation is to set the resistance so that you can breathe out 2 to 4 seconds. You know, if you can't, if the resistance is too high and you can't breathe but only a second, put the resistance a little bit lower, and you work your way up, and then you can work and try to maximize the resistance so that it's comfortable to breathe out for 2 to 4 seconds. So that's the way you gauge how much resistance you need. You can breathe out for 2 to 4 seconds, okay? Oops. In terms of cleaning and disinfecting, again, I'm preaching to the choir because you guys know a lot more about this than I do. What I'm saying in terms of the A Replica, the manufacturer recommends that you do not soak. So let me take this apart here. So there's only one way these things can go together. So there's male and female parts to this, right? So this is the mouthpiece, it comes off. This is the adapter and the manometer, it comes off. And this manometer further comes off as well, like this. So this manometer, this pressure gauge, they say should not be soaked. But this adapter for the manometer can be soaked, okay? And then this guy, this main component right here, there's two little tabs here on the side that you press in and this thing comes off. And correct me if I'm wrong, Debbie, but I think you can soak everything here.
Yes,
Yeah,
that's correct.
So you can soak everything here, and you can soak this adapter for the manometer, sorry. And you can obviously soak the mouthpiece, but don't soak, they say, the manometer, okay? And if you don't want to have the manometer in there, you don't have to have the manometer in there. So let me put this back. Again, this just snaps in. So if you don't want to have the manometer in there, you can just put the mouthpiece in there. Okay. You say, well, there's two holes here, but then this doesn't fit here. So there's only one way it can go in, all these pieces. So if I can do it, you all can do it. Okay, in terms of putting it back together, because there's only one way it can go. Just be gentle, because if you try to force it, you could potentially break it because they're all plastic, okay? So the recommendation is to take it apart, soak it in warm soapy dishwater, not your dish, a clean bowl, okay? not your actual dishwater. But use a clean bowl, just tap water, put some dish soap in there, warm, and let it soak for 15 minutes. Rinse it really well with either tap water or distilled water, or you could rinse it with tap water first, and then the final rinse could be with distilled water, okay? And let it air dry really well, because anything that accumulates water, or shake it out, anything that accumulates water, especially in a humid environment, you're gonna have fungus growing in there. And the last thing you need is to have fungus contamination of your A Replica, and then you breathe that fungus into your lungs. By the way, I don't have any conflict of interest. I'm using these brand names because that's what you're familiar with. I don't even know what company makes it. I just know the brand of this device. So that's daily cleaning, okay? Probably do it, after your evening treatment. That way it can dry overnight, so when in the morning it's all ready to go. And they also recommend, the manufacturer also recommend disinfecting it with one of the 5 methods below. I originally had 4, but then Debbie told me about the sterilizer that she knows about. By one of the 5 methods below, you could boil it, put it in a colander and then place it in boiling water for 5 minutes. Some people use.
A question about that. Dr.
Yeah.
Falkenham says that it takes 10 minutes to kill NTM bacteria. So would 5 minutes do it on this, or is it 10 minutes that we need to do it?
I would go with what Dr. Falkenham says.
Okay.
10 minutes. And I probably need to change that then. That's
Okay.
what I saw on the manufacturing thing. But the thing is, they're probably talking about bacteria in general. And
Yes,
NTM are hardier bacteria. You're absolutely right. So go with 10 minutes. Microwave steam bag. Again, I don't know how long to microwave them for, you know? So these are things that you all know that I really don't know. You could soak it in 7 parts, so diluted rubbing alcohol. It says what? Soak for 5 minutes and rinse well. You could soak for 30 minutes in 3% hydrogen peroxide. Again, rinse well afterwards. Or you could use a sterilizer that Debbie knows about, whether it's a steam sterilizer or UV sterilizer. Anything more to add on that?
No, I
Anybody?
think that's pretty much it.
Yeah, and you know, you guys will, each of you will find your own best way to clean it. And then, you know, sort of inspect it once in a while, right? Look at it. If you see like black mold on it, that's not a good sign, especially if you live in a warm, humid environment, much more likely to grow mold. Mold is what you're really concerned about in these good stuff. So we talked a little about hypertonic saline, right? So you can use the hypertonic saline just as a nebulizer by itself, or you could use it through either the acapella choice or the A Replica as well. So you can kill 2 birds with 1 stone. You can do the OPEP treatment as well as the hypertonic saline. And the usefulness of hypertonic saline is well established in patients with cystic fibrosis. People with cystic fibrosis get bronchiectasis, they can get NTM lung infection. It's been shown to improve their lung function and decrease the amount of flares that they have, okay? Plus, it also makes them feel better too. In non-CF bronchiectasis, in other words, in those individuals who do have bronchiectasis but do not have cystic fibrosis, there's been only like about 4 studies looking at this, and it appears that hypertonic saline helps with the ability to bring up the secretion or the expectoration of the phlegm, okay? Dr. Kevin Winthrop at Oregon University is doing a study on hypertonic saline, specifically in NTM lung disease patients, to see whether it helps or not. And I'm sure he's going to be looking at to see whether it helps them feel better. Does it improve their quality of life? Does it help bring up their secretions better, which we think probably does? And does it improve their lung function? And probably the 4th thing would be, does it help clear their NTM infection? You know, so he's going to be looking into that. And he has a talk specifically about hypertonic saline that I've listed up there that you can watch on YouTube. The whole talk is on hypertonic saline, and I have only 1 slide here. So the mechanism of action is that, as you can imagine, it helps draw fluid in. So the hypertonic saline, you know, coats the mucus, and the saline helps draw fluid from your airways. It's supposed to help improve your hair cells that are remaining, beat better. It helps stimulate cough. And as Debbie alluded to, it could potentially have some antimicrobial effect. In other words, it could potentially help kill the bacteria that's there as well. So as I mentioned, NTM doesn't really grow well in ocean water. Ocean water is 3.5% saline. Okay, so if you take ocean water and measure the amount of salt in ocean water, it's about 3.5%. NTM does grow well in 1 to 2% saline. Okay, but it gets killed at anything higher than that. So you can imagine, maybe that's why you don't find much NTM in the ocean water itself. You find NTM on the land near the ocean, and you find it in water where the ocean water mixes with fresh water, right? The estuaries, the brackish water. Now, those contain a lot of NTM. But in the ocean itself, you may find 1 or 2 different types of NTM that are hardy in the ocean. But the ones that causes lung disease, you don't find them in the ocean. Probably because the amount of salt in the ocean 3.5% is too high for the NTM to grow in. Okay, so that kind of makes sense because the hypertonic saline that we typically use is 3%, 6%, and 7%. Much higher. Certainly the 6 and 7% is much higher than what you find in the ocean, and 3% is what's closer to what you find in the ocean. So it could have some antimicrobial effect as well. So as I mentioned, it enhances the ability to cough up the mucus. Let me see what I wrote here. Let me move you guys' picture here. So it reduces sputum stickiness. And it's been shown in some studies to reduce the amount of flares that you have with your bronchiectasis. And certainly in people with cystic fibrosis, it's been shown to enhance lung function and may enhance quality of life as well. So the typical dosing of hypertonic saline is 3 or 7%. I would start off with 3% because I think 7% have a lot more side effects like throat irritation, cough, and bronchoconstriction or wheezing in somebody who is susceptible. So start off with 3% first. And if you tolerate that and you seem to derive some benefit, go and give 7% a try. If 7% is have too much side effects, go back to 3%. Because some studies have shown that isotonic saline, which is even less than 3%, may actually help as well. So 3 or 7% would be fine. Oops. So I just showed a picture of postural drainage. With these A Cappella and A Replica, many years ago, people with bronchiectasis, they used to sort of hang them upside down in all sort of different positions that I've shown you here with cupping and clapping, right? So you cup your hand like this and you basically pummel their chest. And the red areas is where you beat on their chest, okay? And the different position is to drain different lobes of the lung, okay? So for example, if you want to drain the upper lobe, you want to probably put them in a sitting position and cup on their shoulders, okay? And those are all different positions for different regions of the lung that you want to target cupping and clapping. So a couple of caveats to this. Some people still use cupping and clapping, especially for children who may not be able to use these devices. And some even adults, they may derive benefit from these types of cupping and clapping maneuvers, especially if you have a family member who is very good at it. And you can use some of these positions even with the A Cappella choice or with the A Replica. Some of them may be kind of difficult, but for example, let's say you want to drain this part of the lung right here, you could potentially lie on your right side as with the head down a little bit and use the A Replica in that position, for example. You could combine them. And a couple of other caveats is that you should probably do some of these maneuvers on an empty stomach, right? Because, this one right here, you can imagine some of the stomach contents could go up into your esophagus and find its way into your lungs, which would not be good at all, okay? And certainly if you have known gastroesophageal reflux, especially if it's severe, you should probably not do some of these maneuvers, positions, because that will make your reflux worse. And then you could potentially aspirate some breakfast into your lungs, for example, okay? So be careful with these, some of these procedures. They may be good for some people and not good and potentially harmful for some other people. Oops. So just as a summary, I didn't go through everything here, but I talked about hypertonic. So these are pharmacologic agents to try to help clear your mucus. I talked about hypertonic saline. Now, pulmozyme is an enzyme that breaks up DNA. So a lot of the stickiness in your sputum is due to the DNA. If you look at pure DNA in a test tube, it's like this really slimy, sticky material. And the DNA is coming from your inflammatory cells that died. And your inflammatory cells have DNA in them. And when they die, they release the DNA. And the DNA is what makes it sticky. Well, there's this enzyme known as pulmozyme that chews up DNA, okay? One caveat to this, though, is that not everybody should be getting pulmozyme. It's only been shown to be helpful, and I don't know why, but it's only been shown to be helpful in people with cystic fibrosis. In people with bronchiectasis, not due to cystic fibrosis, it's not only not helpful, but it could be potentially harmful. So most of you are not going to get pulmozyme unless you have cystic fibrosis. Okay, so don't see this on there and ask your doctor for it. Do not ask them for it if you don't have cystic fibrosis. Okay. So guaifenesin is expectorant that it comes in pill form and probably in liquid form as well. It's to try to help thin your mucus and help you bring up the secretions. It's a common drug that a lot of people find helpful. Some people don't, but some people do. So you have to experiment to see whether it's helpful for you or not. I don't have any experience with inhaled mannitol. Inhaled mannitol is a sugar that you inhale and start to help draw fluid into your mucus to help thin it and break it up and everything. I'm told that it's hard to use because it has a lot of side effects. It can cause a lot of irritation in your airways, causing you to wheeze, cough, and everything. So I think a lot of people cannot tolerate it. And I don't know of anybody who is on inhaled mannitol. I think it's been more studied in people with cystic fibrosis, right? So these are pharmacologic agents to try to help clear up your mucus. These are non-pharmacologic agents. I've talked to you about the A Replica, the acapella. I mentioned the high frequency oscillatory vests, that there are vests. There's many different brand names for it. Some people use the lung flute. I don't know of anybody using it, but it uses sound waves to try to help break up mucus. So you like the acapella and the aerobica, you blow into it, but there's a reed in there and it flutters and it creates sound waves to try to help break up mucus in your lower airways, okay? And I mentioned about postural drainage and chest physiotherapy. So incentive spirometry is that device that people get after surgery. It's unlike the aerobica and acapella, it's for you to breathe in, right? When you breathe in through this incentive spirometry device, that ball goes up. It's trying to basically help expand your lungs, okay? So aerobica and acapella is to blow out, to create the back pressure, to stent your airway open. Incentive spirometry is to sort of open up your airways as well in a inspiratory fashion. I mentioned to you about huff cough. Very important to keep hydrated. Very important to exercise in moderation and to your ability. By exercising, you're expanding your lungs in different lung volumes. I think a very good exercise is just walking. And I think another good exercise, because it's safe on your joints and everything else, is rowing. I think rowing is probably one of the best exercise there is, because you can expand your chest when you row back. You're taking deep breaths. You're exercising your legs without pounding on your knees and everything. So I think all those are very important. Oops. Again, I only have one slide on nutrition. We do know, and this is my area of why some people get NTM lung disease and some don't. Most people with NTM lung disease, they're usually generally thin. And they're usually thin to begin with. It's not because their lung disease caused them to eat less or whatever that caused them to be thin. So they were thin sort of pretty much all their lives. And we do know that thin individuals are more predisposed to tuberculosis, which is a cousin of NTM. And we think also that thin individuals are predisposed to getting NTM lung infection as well. So you want to try to maintain an ideal body weight or closer to an ideal body weight, and you may need help with that. You don't want to gorge yourself with food and then vomit and then aspirate that either. So you want to eat healthy foods, foods that have high quality calories. So for example, like certain fats are better than other fats, right? Like avocado fats are good, olive oil fat is good, canola fat is good, fish fat is good. But you don't want to eat like, lard fat or beef fat or things like that. One drug, and again, this is just from personal experience with my mother. My mother had like advanced dementia, and she had lost a lot of weight because she wasn't eating, probably partly related to her dementia. And she was waking up middle of the night, probably because of her dementia as well. And one medicine that I found really helped with her sleep was mirtazapine. Again, I'm not prescribing it for you guys. You have to ask your doctor about this because, different people react differently. Mirtazapine doesn't cause delirium the next day. So that's one thing good in people with dementia for my mother. So that she was able to sleep throughout the night better with mirtazapine. But one side effect of mirtazapine was that it increases your appetite. And it was really good with her because, she got down, she wasn't very tall to begin with. She was like normally like maybe a little over 100 pounds, but she got down to 65 pounds. But the mirtazapine really made her eat a lot. And I was able to get her up to 75 pounds. So it helped me and her. So I just want to let you know about that. Make sure your vitamin D level is at the good level, right? And the good level for the 25 hydroxy vitamin D is 30 to 60. You don't want to be too much. So don't take too much vitamin D because vitamin D can be toxic to your body because it's a fat soluble vitamin. It doesn't, when you take too much of it, it doesn't get excreted out. It accumulates in your fat. So you can become toxic from vitamin D. So be careful, everything in moderation, right? But you don't want to be too low either because vitamin D is obviously important for bone health, but it's also, we think it's important for your immune system as well, okay? And if needed, find it, if you're underweight or whatever, find a nutritionist to help you guide your diet so that you can gain some weight. A little bit is better than nothing. I want to talk a little bit about gastroesophageal reflux because we think that's a potential mechanism of how you can get NTM into your lungs. So, if you swallow NTM into your stomach and it doesn't get killed and then you aspirate it and then you reflux it back up into your throat and some of the secretions and NTM that's in the secretion goes into your lung, that's how you could potentially seed your lung from that, right? And the significance of gastroesophageal reflux, you think, well, it's just reflux, it's just heartburn. I mean, like, how serious can it be? Well, the amount of reflux in the United States is actually going up. And I can tell you, reflux can really damage your esophagus. And you have to take reflux seriously because with constant reflux, that damage can turn into cancer of the esophagus. And I had a gentleman who had severe reflux. He sees his gastroenterologist regularly. They take a scope down there and they take biopsies to make sure it hasn't changed into cancer. And then 8 months later, he had cancer of the esophagus from the reflux, despite the fact that he was being screened by the gastroenterologist on a yearly basis to make sure it didn't turn into cancer. So take reflux seriously from an esophagus point of view, because the worst thing that can happen is that it can cause esophageal cancer. But from our interest about reflux is that, as I mentioned, some of the reflux that goes in your esophagus and your throat can go down, find its way into the lungs. It can damage the lungs, but can also seed the lungs with different types of bacteria, including NTM, okay? Just remember, well, I'm taking omeprazole, so I don't have reflux anymore, right? Wrong, right? So antacids such as omeprazole, pantoprazole, you can't find Zantac anymore, or other types of antacids, they cut down the acids and they treat the heartburn symptoms. So heartburn is when acid goes up your esophagus and makes you feel like you're having a heart attack. It's the acid. So antacids alleviate the heartburn, but it doesn't prevent the reflux. So you're still refluxing. You just maybe don't feel it anymore, okay? Just remember that there are certain drugs that can worsen reflux, and I've listed a number of them here. I sort of highlighted albuterol because albuterol is an inhaler. It's a bronchodilator. And I see a lot of people with bronchiectasis being put on albuterol when they don't really necessarily need it. It's not asthma. It's not COPD. I mean, it is airways disease. So you have to see whether albuterol helps you or not. A lot of times physicians just sort of reflexively, oh, you have airways disease, you have bronchiectasis, let me put you on albuterol. And it may or may not help. And if it doesn't help, it could be potentially harming you because it could potentially worsen reflux. The reason why it worsens reflux is that there's a little trap door between your esophagus and your stomach. And that trap door opens up when you swallow food or drink water, okay? But then when you're not eating anything, it sort of shuts down to prevent stuff from the stomach going back up into your esophagus. But albuterol and these other drugs sort of relaxes that sphincter, that trap door that I mentioned. And therefore, you can worsen reflux basically with albuterol, okay? And there are certain foods, I know that for me, if I eat chocolate and I sort of lie down, man, I get a lot of reflux with the chocolate. So, so there are certain foods that people can eat that can worsen reflux. So be careful about that. Measures to prevent reflux. So simple measures, right? Mechanical measures. No food or drink within 3 hours of sleeping. And always sleep if you have reflux, or even if you don't know, even if you don't know whether you have reflux or not, but you have bronchiectasis, if you can, try to sleep with your head of the bed elevated. A lot of patients, they don't necessarily like foam wedges, so they always tell me, oh, you know, like I prop myself up with pillows. When you prop up yourself with pillows, you don't have that gradual incline like you do with a foam wedge like this, okay? Or like this. So the recommendation is 30 degrees or higher. And I put in question mark, does Medicare or VA pay for adjustable bed? You know, I still see patients at the VA, and I always told them, I said, well, if you have Medicare, I'm told that Medicare, if you have reflux, will pay for an adjustable bed. But then I had a VA patient recently, a few months ago, tell me, oh, you know what? The VA paid 100% for an adjustable bed for me. So you might want to check your insurance, whether it's Medicare, VA, or any other type of insurance, that if you do have reflux, especially lung disease associated with the reflux, will they pay for an adjustable bed? Because an adjustable bed is just much easier to maneuver and adjust than these foam wedges, right? And this one I just saw online. I mean, it's like the Cadillac model of foam wedges. Look at this. Because a lot of times people tell me, well, I don't like the foam wedge because I keep sliding down in the foot of the bed. So if you have something like this lady has on the left-hand side, you're obviously much less likely to slide down, okay? Now, in terms of which side to sleep on, the recommendation is the left side is better because just your anatomy of your stomach to your esophagus, less likely to have reflux if you lie on your left side. And avoid sleeping on your stomach because you're more likely to potentially have reflux and aspiration from the reflux. So in terms of surgical procedures for severe gastroesophageal reflux disease, I'm not an expert in this. How are we doing on time?
Yeah, I was just going to mention we're almost at the hour and a half point. So
and I'm almost done. Okay. Don't take this lightly. Get second or third opinions. This nisinfluenzaal application is a little more invasive procedure. Is wrapping your top part of your stomach around your esophagus. This LINX procedure is this magnetic ring that they put around the bottom of your esophagus, And it's sort of, when you swallow food, it sort of opens up on its own from the force of the food to allow food to go through. But then when you're not eating anything, it sort of clamps that tight. Just remember, there's a lot of people who do potentially benefit from it and some people who do not benefit from it. There's potential complications even from this minimally invasive surgical procedure. So go through these procedure very seriously. I mean, think about through it before embarking on it. This is my last slide. Avoid inhaling aerosols of any kind. Raise your hot water heater temperature to 130 to 140. Flush it regularly. Keep your vaccination updated. Take measures to prevent reflux. Avoid cigarette smoke exposure. Keep your weight at a good level. Eat healthy fats and vitamin D at a good level. If you're prescribed antibiotics, take it as directed. Do airway clearance religiously. And if you're low in oxygen or using supplemental oxygen, get a pulse oximeter. Join support groups like you have done. You can find a lot of very nice information from various websites, including NTM-IR resources. Find medical professional with expertise to treat NTM lung disease. And very important, in a 3-ring binder or whatever, keep a record of all your key medical tests so that you can keep track of them, a list of your medication, etc. So that's the end. I'd be happy to answer any questions.
Thank you, Ed. That was really wonderful. We've heard some of this from other people, but you're a lot more credible than we are. And we really appreciate hearing it the way you told it to us. I think everybody really enjoyed it. And we have a few questions that I'm going to try to get to.
Okay.
So let's start with, let's see. Okay, so this one's about shower head cleaning. Is chlorinated cleaning used only? What about vinegar? Is vinegar effective in cleaning shower heads, getting rid of NTM?
I think the recommendations that I've seen, I think that's what you mean is hypochlorite is bleach.
Yes, I'm gonna weigh in on this one because I did ask a question to Dr. Falkenham, and vinegar is not going to be as effective. It's not going to be effective at all. So I don't. So I would say stick to the bleach. I think the issue with the bleach is if some of the shower heads are not necessarily metal. Some of them have like a chrome finish.
Yeah,
it could come off, but you'll see that and maybe react accordingly. See what you're going to do. Maybe that's not the one to buy. I've been having that question myself, so I think I'm going to experiment with my shower head and see. So thank you for that question. Here's another one. We're in the desert, and we were wondering if the dirt and the soil from hiking is the same, is as dangerous as the soil that we garden regarding NTM.
So the soil that you're exposed to in hiking trails, is it the same as what's around your garden?
Correct.
The short answer is I don't know, but I think you should assume that any soil can contain NTM. I would think, depending on the hiking trail, if there's a lot of moist, dead vegetation in those soil, they're potentially more likely to contain NTM because that's food stuff. Those decaying vegetation is food stuff for the NTM. But on the other hand, those type of soil, they're less likely to get aerosolized, right? If you go into more of a deserty, dry climate, they may contain less NTM, and yet they're more likely to be stirred up because they're not wetted down. So I think, there's different risk factors.
So that's interesting. Maybe oh, you're breaking up. I don't know why, Ed. Oh, your internet connection is unstable.
Is that what it says?
Wow. Can everybody?
Okay.
Oh, okay. Now we're a little better.
Oh,
Okay, so the
let
other
me,
question was, do you go ahead.
oh, you're breaking up too, Debbie.
I'm sorry, I didn't say much, but I think it might be your internet connection, Ed. I'm not sure.
Oh, so
Or
you didn't
mine.
hear, you didn't
Usually,
hear, you didn't hear what I said about the soil, hiking soil?
yes, we did hear that.
Okay, okay, good.
Yes, thank you. So I guess the recommendation would be maybe to wear a mask when hiking. Would that help?
You know, I think if there's a lot of dust and a lot of windy days, I would try to avoid hiking in those days. You know, it's hard to hike with a mask, right? I mean, you know,
True.
I think you just have to play it by ear. If it's sort of, if it doesn't look very dusty, you're probably okay. And because there's a lot of air
Good. Okay.
exchange.
Yes. Okay, that makes sense for sure. Are air purifiers recommended for people like us?
Oh my gosh. I don't know. To be very honest, I
You
don't
don't
know.
know.
One thing about air
Okay, so
purifiers, I would think that one thing about air purifiers is that, you know, you got to make sure that those filters get changed because they could potentially accumulate stuff, including fungus and everything. Um, yeah, so I don't think it's, I think just from the air itself, I don't think it's a big source for NTM. But I think if you're sort of in a um, garden, for example, environment, if you're stirring up soil, that's probably even riskier than just sort of being in your home. You know.
okay. Okay. Thank you. So this next question has to do with singing or playing an instrument. Should that help open the airways?
I would think so. You know, I mean, just be aware that certain instruments, you can get a hypersensitivity pneumonitis from it simply because, you know, especially the well, only the wind instruments, right? You could have some saliva secretions accumulate inside the mouthpiece or parts of the instrument, and fungus can grow in there. And people have shown that you can get a hypersensitivity pneumonitis from certain wind instruments. So just make sure your wind instrument is clean.
Right.
But
Okay.
it should be
So, I
good.
mean, yeah, there might be better ways of airway clearance that might help, but again, it might have more risks than the typical ways that you discussed. Okay. Is a BiPAP machine mask safe to use for somebody with bronchiectasis and NTM?
Yes, yes. You know, bilevel is typically used for people with sleep apnea, as well as people with respiratory failure, such as people with emphysema, or people with neuromuscular weakness, such as ALS, Lou Gehrig's disease. So it's used for various types of neuromuscular and respiratory disorders, but in itself should not be a contraindication for people with bronchiectasis. In fact, it might help them stent the airways open night times when they're sleeping. But it could potentially help bring up phlegm as well, you know. So I think it could be help. And then you just have to play it by ear. If you find that, you know, it's making you cough a lot more or bring up secretions and then disrupting your sleep, then it could potentially not be very helpful. But if it's making you feel better at night with sleep, then by all means use it. But it's not a contraindication at all.
That's good. From what I understand, you have to make sure it's cleaned well after each use.
Oh yeah, especially the humidifier reservoir, right?
Yes.
Only fill the reservoir, the humidifier reservoir for the bilevel or the CPAP with what we recommend, sterile water, or the next best thing would be distilled water.
Thank you. Okay. Now this was a question it looked like to the group, but I'm going to ask it to you. Does anybody use a sterilizer bag in the microwave? Is 2.5 minutes long enough? Will it tolerate being microwaved for longer periods of time? Do you know anything about that? Because I could
No.
weigh in a little bit. So I use a sterilizer bag every other week. Even though I use a UV sterilizer, I still want to make sure that everything is touched inside. And I think it is, but it's a double hit for me. So the recommended time is 3 minutes with a quarter of a cup of water.
Mm.
And we know from the water studies that it really takes 10 minutes for NTM. These instructions are general instructions. Most people who use them don't have NTM. So I was trying to strike a balance between 10 minutes and what the manufacturer instructions say. But I'm afraid 10 minutes will melt it. So I've added a minute on. Instead of 3 minutes, I've added 4 minutes. And instead of using a quarter of a cup of water, I've used a third of a cup of water. And I think that if you increase the time, you need to increase the water. Otherwise, it could dry up and melt. And again, for me, since I'm using the UV sterilizer every day, other than that once a week time, I think I'm striking a good balance between trying to clean it well. So I would say the best and safest way of cleaning or disinfecting rather once a week is boiling for 10 minutes. That makes me feel safer. Everything short of that, I'm not quite sure of, and I don't know if there are studies that have been done on that. Okay, so do you have anything to add to that, Ed?
No, I just have a question. So when you boil it, the recommendation is use a colander.
Yes.
So you put the device on top of the colander and just do you submerge it when you're boiling it?
So I haven't used the colander, but my pots are very heavy duty pots. So I think there are certain pots that might melt it and other pots that might not. So I haven't had that problem, but I know of other people that have had that problem. So again, you've got to figure out what's best for you. If you could put something in there like a colander to prevent the pieces of the aerobica or the acapella from hitting the bottom, which gets
Right.
the hot, that's what needs to be done. So let's go on to the next question. What you talked about not taking too much vitamin D to stay healthy. What are the signs of detoxicity?
Signs of toxicity from vitamin D.
Yes.
It's too much calcium absorption. So vitamin D works by increasing your calcium and phosphate absorption from your intestine. And so if you take too much vitamin D, your calcium can go up very, very high. And to the point where it can be toxic to your brain and your heart. So it can cause various types of arrhythmia. It can cause depletion of potassium. It can do a lot of electrolyte abnormalities that can irritate your heart and your brain.
Thank you. And what would be the symptoms of that? Like brain fog or heart malfunction, things of that sort?
Yeah, lethargy. It can also cause constipation. And I guess if you have arrhythmia, you can have palpitations. And if it's serious, your blood pressure can drop and you could faint.
Okay.
Yeah.
Those are pretty serious symptoms.
It could be very potentially serious, yes.
Okay, so next question, can you go back to what makes reflux worse? Are acid refluxers bad for you? Oh, I'm sorry, are acid reducers bad for you? That's a double question.
Is reducing your acid in your stomach bad for you? Is that the question?
Yes. Are acid reducers bad for you?
Oh, are acid reducers bad for you? Yeah, no, that's a good question. So, there's these, the most common one they use now are these proton pump inhibitors, right?
Yes.
like omeprazole, pantoprazole. I mean, they're used very
Yeah.
commonly.
Prevacid, common names, yes.
Yeah, yeah, Prilosec, exactly. They're coming out with more and more potential risk associated with these antacids. It used to be thought that, oh, well, they're just antacids, right? They're harmless, right? But let me think here. But for example, they increase your risk of getting pneumonia because you're not sterilizing any bacteria that's being swallowed into your stomach. And if you do still aspirate, the bacteria can then seed your lung and cause a pneumonia, right? So it's like a double-edged sword there. They've been linked to a particular type of intestinal infection known as pseudomembranous colitis, what they call C. diff colitis, because you're not having that acid sterilize it. It's been linked to osteoporosis. I think it's been, don't quote me on this, but long term, it's been linked to potentially dementia. Some of these have greater evidence than others. So if you go online and type in side effects of proton pump inhibitor, you'll probably get 6 or 7 things that it can potentially cause. But acutely, it's fairly harmless. It's more of chronic use of it.
Okay.
Problematic.
And what about substituting famotidine, which works differently? Is that preferable if that works for people?
Yeah, I mean, more of the side effects that I just mentioned have been linked to PPI, proton pump inhibitors. Famotidine is a H2 blocker. It could potentially increase your risk of getting some of the other opportunistic infection as well, because you're not sterilizing bacteria that gets into your stomach. But yeah, I mean, I think they're fairly interchangeable.
Okay, but yet I know that the National Jewish Doctors will say there are some patients that absolutely need the H2 blockers or the PPIs. You have to make sure you have a doctor that assesses your case and can evaluate the risks and benefits for the individual patient. And then there was, let's see. I think what the same person asked, what makes reflux worse? And I know you gave a list of those. Maybe what I can do is ask you for some of the slides from this presentation and add it to the to my newsletter, and that would have a list. I mean, it's the basic GERD list that people know about, and you did mention it during your presentation. And then let's see, is there a difference between the waterfall shower head and the mist shower head?
In terms of risk of getting NTM infection, yeah, I assume. No one's actually done the study on it, but sort of intuitively, you would think that the waterfall shower head would have lower risk of getting NTM infection from the showering, simply because it's like a waterfall, right? It's not generating these fine aerosols that can be potentially inhaled in and deposited the NTM into your lungs. So our best guess, and I think most physicians would agree with me, that theoretically the risk is lower with the waterfall shower head than the fine mist shower head.
Yes, and one of the people in the group has mentioned that she just removes the shower head totally and takes the shower straight through the pipe.
Yeah,
and that probably makes a lot of sense.
That does make a lot of sense.
It's something easy to do, and anything to avoid mist or anything to avoid exposure.
Yeah, well, that makes a lot of sense.
Yeah, I think so. So anyway, here's another question. I substituted digestive enzymes for my acid reflux medicine. It does seem to get rid of symptoms, but of course, not sure if it actually helps GERD. You know anything about that?
Well, neither of those really helps GERD, right? So what the antacid does, the like the proton pump inhibitor, like omeprazole or famotidine, those antacids, what they do is they cut down the acid so that there's less damage to the esophagus, because it's the acid that's what's damaging the esophagus. But 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 digestive enzymes would not treat reflux or would not cut down the acid.
So I guess there's a hidden question in this one. If you take digestive enzymes, would you digest more efficiently, and would you have less GERD because of that? Or is there any connection?
I don't think so. I mean, not that I know of.
Okay.
And the digestive enzymes may not work that quickly to prevent GERD. You know what I mean? It takes time to help digest the food that you eat. And I'm not even sure that they help unless you're missing certain enzymes already in your body, because you have very good enzymes that are produced by the pancreas. So I guess the question is, you know, people with cystic fibrosis, right? They have abnormalities of their pancreas, and therefore they don't produce enough digestive enzymes. And they require digestive enzymes to digest their foods. But if you don't have cystic fibrosis, or you don't have problems with your pancreas, pancreatic insufficiency, we call it, then you probably don't need digestive enzymes. But, you know, I think each case has to be taken separately.
Yes, that's true. That is absolutely true. Well, with that, I think we've gone through all the questions. Thank you so much. We've appreciated everything that you've done for us, and we know we can always count on you. So thank you again. And I think we'll be seeing you again.
Yeah, I think I'm giving a talk again a week from now, Debbie.
You are.
Yes. And by the way, I did email you before my talk. I did email you a PDF file of my talk.
Oh, thank you. I haven't checked the messages.
Yeah, just in case we have some technical difficulties. So you have the list there of all the foods and drugs that cause reflux.
Thank you. And so again, we appreciate everything. A great presentation, and can't thank you enough. Take care. Have a good month, everybody. Oh, the next meeting for the California group will be the first Monday of May because of my travel schedule going back to Connecticut. I'm sorry. Yes, going back to Connecticut. So I will remind you before the meeting, but it will be in 3 weeks instead of 4 weeks, just for May and for October too. Okay. Have a good one. Take care, everybody.
Bye.
Bye-bye. I'm going to start with a few that were submitted in advance. So one of them is by somebody who couldn't be on the call today. So her question was, can you ask about thrush from inhalers?
Yeah.
Yes, there are certain inhalers that cause it, and what would you recommend can be done?
Yeah. So thrush is basically a yeast infection in the back of your throat. Sometimes it can present with just sort of redness, but sometimes you can have these little white patches in the back of your throat. If you see that and you're using an inhaled steroid, so it really only occurs in people with inhaled steroid, okay? It doesn't occur in people using albuterol or other bronchodilator. So, but if you're using an inhaled steroid, you get a thrush infection in the back of your throat. It's just more of a nuisance than anything else because it can cause pain. The recommendation is that if you use an inhaled steroid, such as fluticasone, mometasone, and some other ones, I can't remember top of my head, but the recommendation is to gargle and rinse your mouth after use of an inhaled steroid. And typically inhaled steroids are used once a day or twice a day. So it's not too inconvenient, right? So just after using it, gargle and rinse your mouth out so that the inhaled steroid doesn't get stuck in the back of your throat. The other thing is to use a spacer. if your inhaled steroid can be used with a spacer is basically like what it says. It's like a little device that sort of between your inhaler itself and your mouth. And the reason why the spacer decreases the incidence of thrush is because fine particles are more likely to be inhaled into your lungs, and less of it gets deposited back to your throat if you use a spacer, okay? So use a spacer, rinse your mouth out if you use an inhaled steroid to decrease thrush.
Thank you. That's a great answer. I know there are more than just a few people that have that problem at times. The next question. What are developments in treating NTM with phages and developments in treating bronchiectasis? And if this is not your ball of wax, please feel comfortable to say that.
Well, I know a little bit about it. There was a paper that was published in a very prestigious journal from University of California, San Diego. It was on a young person, I think 15-year-old cystic fibrosis patients with Mycobacterium abscessus subspecies massiliense, okay? And the purpose of this paper was to show that with a cocktail of 3 different phages. So phages are basically viruses that infect bacteria. So COVID-19 infects humans, okay? Phages are viruses that doesn't infect us, but infect bacteria. So it kills bacteria. So they're sort of like assassins for bacteria, okay? And so you think, well, it makes sense, right? So if you can inhale a phage or take in a phage that kills the bacteria that you want to kill, but it doesn't hurt you because they don't infect your cells, then that would be a good thing. So this paper showed that this patient, 15-year-old with cystic fibrosis with this NTM, who was refractory to treatment, was quote unquote cured when they gave him or her a cocktail of 3 different phages, viruses that kill this bacteria. I think, I don't know where it is right now. It's a lot of work to create these phages, right? Because phages for John Smith may not work for phages for Mrs. Brown, okay? So you have, they're sort of like tailor made, if you will, for your bacteria, okay? And not every M. abscessus, are going to be killed by the same phages, for example. And one thing this paper did not really emphasize was that they also continued the antibiotics on this 15-year-old. So it was a combination of both antibiotic and phages. So I think it's very promising, especially for drug-resistant NTM. And I think, I don't think it's ready for prime time yet. But again, I'm not working in that field. And, there are places in the country like UC San Diego, which is a hotbed, and University of Pittsburgh is the other place that is a big phage centers. So I think stay tuned, but as far as I know, not ready for clinical use yet on a regular basis.
A lot of us agree with that. It's intriguing, and I hope that they pursue this avenue of treatment, but we're not there yet, and that's something that could be up the line. Next question. There are 2 questions related to dentistry. If tartar on teeth is a possible source of NTM biofilm, what preventative dental care should NTM patients observe, and how frequently should teeth cleaning be done? And a related question is, what about the water pick? Is that dangerous for NTM and bronchiectasis patients?
Yeah. Well, let me just talk about the dental stuff first. There's 2 papers that I did not talk about from Germany, I believe, in which they showed that you can find quite a bit of NTM in the dentistry water. And you can imagine, right? I mean, you got your mouth wide open, and they're sort of like rinsing your mouth with this sort of fine irrigation of water, like the water pick. And it's creating all kinds of little droplets of water. And you got your mouth like wide open there, and you're like probably inhaling all kinds of stuff in there. And I don't know, look, if you look at those dentistry water, they don't just, they're coming out from this little thing next to your dentist chair, right? And like, is there biofilms in there? I don't know. I'll bet you there is. I've always thought that, I don't want to scare people away from dentists, because I think that's a very important part of your health care, is getting your teeth clean. The recommendation is every 6 months. At least that's my dentist recommends. So I think it's because it's good for your overall health, cardiac health, everything, to get your teeth clean every 6 months. So I think you should still do that. But be aware that, that's a potential source right there. But I don't know what to do about it, I'm sure if somebody tries to do a study on dental offices, they would be barred from coming in, right? Because the dentists don't want to have bad press. Oh yeah, Dr. Smith, the dentist, has NTM in his water device there in his office. In terms of water pick, I don't know actually. I think it's much more likely to create aerosols, as you can imagine. Then, by the way, when you use a water pick, I guess it's coming through a water pick device, right? It's connected to a faucet or something, right? Or something? Or do you have a reservoir? You have a reservoir of water.
Yes, that's right.
Okay. So as you can imagine, that could be potentially a source for biofilm formation. Because anything that contains water for any long periods of time, you can get slime on the surface of that container, and that's biofilm, and that's potentially contain high concentrations of NTM.
So what if what if we put that in our steamer sterilizer or boil it, and then use either distilled water or pre-boiled water? Would that help?
Yeah, I think that would help the container, I'm sure. Just like your CPAP device or your that contains the humidified water reservoir. But what about the tubings? From the reservoir to the actual water pick device? I assume there's a tubing there, right?
There is.
Yeah. Is there biofilm that forms along the tubing? Like, how are you going to clean that tubing? I guess you could put it in a sterilizer, but then it's hard to dry those tubings,
Right.
So
you can't get
I actually don't know.
Right. And it's a double-edged sword, because if you don't take care of your teeth, either with the water pick or getting it clean, then you run the risk of I want to call it crud, for lack of a better term, accumulating on your teeth, and you're breathing that in.
Yeah. I think in terms of, I'm not a dentist, obviously, but in terms of your teeth cleaning, I think flossing is very important. That will help reduce tartar buildup. You can get toothpaste that are sort of anti-tartar control, because tartar is sort of calcified biofilms. So you can get, and then you can get those toothbrushes that are rotating, or those electric toothbrushes that are certainly, I'm told, better at removing tartar and plaques than hand brushing. So you can try to do that as well.
Okay, great, thanks. Let's go on to the next question. Does washing a shower head with alcohol kill NTM?
Short answer is I don't know.
Okay.
I think, what did Falkenham recommend now?
I don't think he mentioned alcohol as
I think it's bleach. He recommends bleach, right?
Bleach, yes, bleach.
Yeah. So, I've seen pictures on the internet where somebody wraps a plastic bag that contains bleach. I think that's kind of dangerous to do that, because what if the bleach spills on you?
True.
right? So I think the best thing is probably take off the shower head and soak it in bleach, and be careful of the fumes from the bleach too, right? And some people who have
Yes.
lung disease, they can be very irritating.
Good point.
And I think, and it's probably diluted bleach too. Is it? Do you know?
Gee, I don't recall. I
Yeah.
was under the impression it was straight bleach, but
Straight bleach.
then again,
Yeah.
I might not be correct
Yeah.
on.
Yeah, you would think that would be a little bit, but you know, the bleach that you get from the store is probably somewhat diluted than the stuff that they use in industry. So it's probably okay, but just be careful. That's all. And I really don't know the answer whether you should dilute store-bought bleach or not. But I think the recommendation is to soak it in bleach, and then, you know, get a toothbrush, an old toothbrush, and just sort of scrape out all those crud that could be in the crevices of the shower heads as well.
So here's another related question. I understand the need to take care of shower heads, and at the back end, taking care of the hot water heater. But what about the pipes in between? Some rooms are not used and the water may sit in the pipes. Is it NTM in those pipes?
Yeah, I think, you know, if you think about it, the hot water heater, you could have stagnant water, right? I mean, especially at the bottom, because it's always filled up. And the shower head, when you turn off the shower head, you know, there's some collection of NTM in the dependent part, if you will, of the shower head, right? And so I think the shower heads and the hot water heater, I would think, are more likely to contain NTM, because the pipes, if you will, especially if you're out on the second floor or whatever, wherever your pipes run from the ground up or something, you know, they're gonna when it's off, they're gonna drain off. You know, they're not filled with water all the time. So I would think, and you know, obviously you cannot, you know, rotor your pipes on a regular basis, and you know, if so if you're like buying a new home, or if you need to have your pipes replaced, I guess, I'm pretty sure Joe Falkenham has shown that copper pipes are much better in preventing NTM buildup than galvanized pipe and PVC pipes. I think they're using PVC pipes now because they last a long time. These plastic pipe last a long time, and they're much more economical. And copper pipes are very expensive. But I would check on that. And I really don't know the answer, but I seem to recall a paper showing a paper by him showing that copper pipes are less likely to have NTM buildup. So if that's true, then you might want, and you're having a pipe replaced, use copper pipes.
So your point is well taken about running the water a little while before you actually use the shower. So if there is any NTM that's in there, it could be washed out. I should say running the water and leaving the room. But especially if you have a vacation home that you don't use for a while and then you come back, it's a good idea to run the spigots and the shower head to get some of that out. So let's see. Next question. Somebody said we got an on-demand hot water heater when we needed to replace our old one. No tank involved. They have a higher price tag, but save money in the long run. Are you familiar with that? Can you?
Yeah, I mean, yeah, it's sort of like at the source, right? It's sort of like next to your, closer to your shower head, if you will, than the hot water heater is. And it's sort of, it heats up the water as it's passing through. And again, I'm not an engineer. I don't know any studies done on that. But I would suspect that if this on-demand hot water near the source of the water does not have any standing water, then I think it would be better.
Okay, great. Next question.
Can I contribute to that?
Sure.
I have a tankless hot water heater.
Oh,
and
yeah,
I was told to have it flushed with vinegar every 1 to 2 years.
Okay.
Now, do you know if vinegar kills NTM? I'm not sure.
That's all it was recommended. I don't know.
Okay, but it's recommended for general bacteria. I don't think that your vendor specifically focuses on NTM. So we have to be careful. I mean, that's a fine thing to do in addition to any other thing we can do for NTM, but if anything. But I think that we have to be careful, not only with that, but instructions for anything that we use, like some of us use nasal washes, and even the Aerobica that we use, there are certain instructions that come with it for the general public, but not everybody uses it for NTM. So we really should do the measures that are recommended for NTM.
Okay.
And if I might add, on the flip side of that is that your tankless hot water heater, you got to also make sure that bleach wouldn't hurt it either, right? Like, don't just sort of like use bleach.
Yeah.
It will kill the NTM, and then you destroy that product or something because it cannot stand bleach.
Okay, so the next question, this is something I'm unfamiliar with, and maybe some other people know about it. I use a MicroLife asthma monitor to blow into after doing the Aerobica. It does an incredible job of bringing up mucus, and at the same time gives me a PEF reading that I use to measure how clear my airways is. The more I bring up, the higher the score goes. I'm not familiar with that. Are you familiar with that, Ed?
Yeah, it's I'm not familiar with MicroLife, but PEF is peak expiratory flow, and that's actually a peak flow meter. So it's basically a way that we give asthma patients to gauge in an objective way how their asthma is doing. Because a lot of times people present too late to the emergency room with asthma. And so it has like a green, yellow, and red zone based on how much air you can breathe out. If you're in the green zone, that means your asthma is doing fine. If you're in the yellow zone, maybe you need to increase your medication. If you're in the red zone, you need to take your, you need to go to the emergency room. And basically, it's the amount of force you can breathe out. And so the question was based on how much you can breathe out based on how much you can cough up. Is that right? Sputum.
Janine?
Yeah, so that was me that wrote that. It was less of a question and more of a share because I found this accidentally. I accidentally ordered one of these when I first was diagnosed because I ordered a bunch of different things. But what I find is that when I blow through it, because you have to keep your mouth pretty open. It's like when you do a PFT, your pulmonary function test. And I found that after using the Aerobica, when I blew into this, it would really help way more than the huff cough. So I use it almost in place of a huff cough, but it just also has those monitors. And I noticed that as I get more and more out, I get my score up to 500 on this for peak flow. And it just helps motivate me, honestly, to keep going, until I reach a higher score, which probably before I would have stopped with the huff coughing after getting a little bit up. So,
Janine, that use of that peak flow meter really, as you said, I mean, well, you said you use it in place of the huff cough, but to me, like this, it's almost like a huff cough, Yeah,
and it's a good one because your mouth is like what you have to do to get the score, you really have to be positioned in the right way. I just use it all the time.
Well, I think I'm sure it's not marketed for bringing up sputum, but if you find that, this is a great example of patients, using their own experience. using a device for another reason, helping to bring up the phlegm. And when you say that you bring up more phlegm, your peak flow actually improves on that meter. Yeah,
does.
so that's good. That's good. I would say
Excellent.
keep doing it then.
Okay, next question. Please clarify, this has to do with the breathing that you discussed when we do airway clearance. I should do the pursed breathing and autogenic drainage breathing techniques first, then do the aerobica with the huff and the cough?
Yeah, I think there's sort of either or, personally. You can do those breathing exercises sort of like in between your aerobica, because you can do those potentially anywhere, right? You could do it, if you're sitting out in the park or something and you don't want to be seen using the aerobica. Because if you find that you have maybe feel like there's some secretions there, you could do it just the breathing exercises. Or you don't have the aerobica or the acapella with you. There's sort of more of the breathing exercises is more of a simple way of bringing up phlegm, whereas the aerobica and the acapella is more of an effective way of bringing up phlegm.
So
So
some
I
of
think you
the,
could.
I'm sorry, some of the respiratory therapists have suggested to use the aerobica and then do the huff after to bring up more.
Yeah.
But they're interchangeable in terms of doing it alone. And a lot of us find that doing the huff cough after is very helpful in bringing up or helping the aerobica efforts. Let's put it that.
Yeah. So the two breathing exercises, with those funny names, they have a combination of both breathing at different lung volumes, followed by the huff and active cough. Whereas the aerobica, you have the breathing exercises, you're blowing it into the devices, followed by the huff cough and the active cough. So for both the breathing as well as the those devices, you have huff cough and active cough at the end as well.
Okay, so there's another question about the breathing by the same person. I'm going to read it and I'll weigh in and you can weigh in, definitely weigh in also. I was told to do the huff cough by taking a deep breath and squeeze stomach while slowly breathing out, then do a cough. Please clarify, should I do the huff cough the way you demonstrated today instead? And how I usually answer that is, there are lots of ways of doing it and lots of recommendations by respiratory therapists. And I say whatever works best for you, you can try it a couple of different ways and whatever brings up the most is what you should be doing. Everybody's different. Ed, what would you say?
I agree. Whether you do it forcefully, like really super forcefully, or whether you do it in medium force, I think you have to do it either medium or forcefully because it's trying to help bring up the phlegm. And just like you're fogging the mirror, that can move secretions along. I started using the huff cough whenever, I haven't gotten a cold this past year because of COVID, because we're all taking precautions. But when I used to get colds, I would use the huff cough and really was very effective, much more than the traditional cough, the throaty cough that I call it. Yeah, try
Okay.
huff coughs at different lung volumes and different effort and see what works for you.
Well, we have lots of questions, so let's go on here. We have a question about, does the prevalence of lung problems with COVID patients mean more research will be done that might help NTM?
Short answer is I don't know, but the more longer answer, and I'll make it quick, is we have found in the test tube that alpha-1 antitrypsin helps, in cells, helps fight NTM infection. And I'm actually studying COVID right now too. I mean, not with the virus itself, but with the enzymes that are required to get COVID into the cells. And we have found that alpha-1 antitrypsin helps with that as well. So the one common denominator for me is that alpha-1 antitrypsin, which is a natural protein in your body, the third most common protein in your blood, can potentially help fight NTM infection as well as COVID.
Thanks. That's great. I suspect that they're going to find some correlation between some of the work they're doing with COVID, not only with NTM, but with other diseases. And it's going to be interesting to see what comes up. I think it's going to be groundbreaking. So here's one. How often do the tubes from the hypertonic saline have to be changed or cleaned? The answer is I don't think they can be cleaned. If so, how? What would you say on that, Ed? The tubing on the nebulizer.
Yeah. So can you tell me how long that tubing is?
I think it's 7 feet.
Oh my gosh. I would think, like I own an aquarium. I've been an aquarium hobbyist all my life. And, we use these tubings to get the water out, right? To siphon the water out, to change the water. And man, my aquarium tubing is just so gnarly looking. It's like black, probably with fungus and biofilms and all kinds of stuff. But I don't care because it's just going out, right? I'm not putting it into the tank. So I can imagine that those tubings would be very hard to sterilize and clean. And I do know that we recommend for CPAP tubing to change it every so often, rather than trying to sterilize it. So,
right. I was told by Dr. Hewitt and the respiratory therapist that if you do a treatment once a day with a nebulizer, change it once in 3 weeks, every 3 weeks. And if you do it twice a day, every 2 weeks. And that was told to me a while ago. I don't know if that's been changed or not. I doubt it. But if I find out that it has, I will certainly let everybody know.
Yeah, and certainly if you can make the tubing shorter, that might be better because less surface area for stuff to accumulate.
Okay. We have, I'm going to put these two questions together. And if you can give the short answer on this, because I don't think it applies to too many people. What precautions should diabetics observe with mannitol inhalers? And can you explain what drugs would contain benzodiazepines?
Okay. Mannitol is not glucose, so it doesn't get absorbed into your bloodstream. So I don't think in itself diabetics have to worry about mannitol regarding their sugar. Benzodiazepine is basically Valium, Ativan, those anxiolytic, those drugs that are sedatives, but also they help your anxiety. They're basically Valium and Valium-like drugs.
Okay, thanks. What about, you just discussed, you made a statement, which is certainly right on. Does no food or drink within 3 hours of sleeping recommendation include water and herbal teas?
Yes.
Yes. Okay. That's what I thought. Thank you. I have indoor plants for years. Is that okay? So in other words, is she inhaling anything from the soil that might aggravate her NTM?
I think if they're already potted, they're okay. I think what you worry about is when you're potting plants. If you pot plants in a ray of sunshine, you can see all kinds of, no matter how much precaution you take, you can see all kinds of dust that goes into the air. And you can imagine if an NTM is riding on one of those dusts, you could potentially be inhaling NTM into your lung. So I think the most serious time, or the most dangerous time, if you will, is when you're potting plants. When you're
okay.
And by the way, NTM has been found in potting soil, and the genetic imprint of that NTM was found in the person who was doing the potting soil. So it can be connected.
Okay, so here's another one. Is there a difference between NTM levels in city water versus well water?
I'm told that well water is less. I'm not 100% sure. I don't know
Yeah,
if
Joe
Amy,
Falkenham studies showed that there was very few, if any, in well water.
in well water, okay.
Yes, because
But
there's
having,
a very short transmission between the well and the water source on the other end, whereas city water has to travel from one end to the other end to
right.
be transported.
Yeah, so overall is better, I think, you know, yeah.
Okay, new shower heads are between $30 and $50. If you're going to change shower heads, how often do you recommend changing them?
I don't know. I guess it really depends on how much grime gets accumulated. Like certain areas of the country have harder water, right? More minerals in there, and they're more likely to get caked up with grime, hard grime, and then NTM can get adhere to that. So I would think I would look at it and inspect it and see if there's grime being built up. And if you cannot get rid of the grime with, you know, periodic cleaning, then I would then depend on how frequently the grime builds up, I would replace it. I don't know.
So, there has been discussion mainly by Joe Falkenham, but of course all of us too, that when they talk about putting water filters on, like the Paul filters, and changing them, they first recommended once a month. Now they're recommending once every other month, because if you don't change a filter, they get grimed up with NTM, and then they could
even worse.
NTM, yes, it could leach out. So we've come up with a suggestion that instead of buying the Paul filters, which are very expensive, they might be $30 a month or whatever each time. There are shower heads out there that are you can pick up for $8 or $10 that may be possible to use, and then just throw them out. So again, you're right about certainly right about inspecting, trying to figure out if you have a big accumulation of biofilms, and you can probably check that by draining your hot water heater and seeing what comes out. It's, you know, it's a tough one. I mean, we do all we can, and what wasn't mentioned is NTM in different people are caused by different things. So there are probably some people out there that might be exposed to it through their shower head, and it might not be impacting them, but other people it would be impacting them greatly. So, you know, it's difficult. Sometimes it's hard to figure out. But one way of figuring out anything that I've come up with is just keeping an eye on your CAT scans and your sputum cultures, and see if they're getting worse, and seeing if your symptoms get worse. So, you know, it's a big puzzle that we've got to really figure out. But let's go on to the next question. Is there research being done on the existence of a genetic component to NTM and its proclivity between generations?
Of the bug itself or of the patient, do you know?
Well, the patient, in other words, if I have NTM, does my daughter or granddaughters have, you know, more of a genetic predisposition than not?
Yeah, I mean, I think anybody with NTM lung disease should have their cystic fibrosis gene tested, and should have their alpha-1 antitrypsin, that molecule that I'm interested in, tested.
Okay.
Because those are two conditions that if you have genetic mutations of, you're at greater risk of getting NTM, and that you could pass on to your offspring. And you can do something about those two conditions. So those are the minimum. And then the other thing I would just test, it's not genetic, but I would just test your immunoglobulin levels, just to make sure your antibody levels are okay. Because if your antibodies are low, you're at greater risk of getting infections in general, including NTM.
Thank you. Okay, here's another one. The alpha-1 antitrypsin as a medication for NTM is new to me, and I've been at this for a long time. Are there meds with this chemical? Is it being used to fight NTM? I'm not sure I understand that question, but
Yeah. So there are some people who have alpha-1 antitrypsin mutations in which their alpha-1 antitrypsin levels are very low. And they're getting replacement therapy every week intravenously. So there's no pill for that. It's an intravenous medication. And they're getting replacement therapy once a week, sort of infused back into their body. Now, if you don't have alpha-1 antitrypsin deficiency, my thought is that alpha-1 antitrypsin could be potentially useful, but no one studied that, as a sort of an added drug, if you will. So that's not ready for prime time yet. But that's why I think you should get your alpha-1 antitrypsin checked, because if you do have deficiency, then you can potentially help your NTM infection by getting replacement therapy.
thank you. That's a good point. Last question. If you have a UV sterilizer and dryer and use it daily, and I assume that means a steam sterilizer too, do you still need to boil the accessories weekly?
I think you're better positioned to answer that, Debbie.
Okay, so I think with a steam sterilizer, you probably don't, because you're dealing with very hot water for a period of time, probably around an hour or maybe a little less. I happen to have the UV sterilizer and dryer, and I'm not 100% sure that the UV light penetrates to every single interior part of my device. I think it does, because I'm very careful to put in the parts so that it is exposed to the UV. So I do it just to make sure. I'm pretty sure that I'm getting it all, but I'm not 100%. So I do it, but I think it's a good question. I'm going to go to National Jewish in about 2 weeks, and I will ask that question. I think the UV and the steam sterilizer are kind of a new recommendation by some people, and I think it's something that probably needs to be looked at. I don't know if anybody's doing any studies on it, so I would suppose I'm not going to get a definite answer, but I'll certainly try. So is there anyone out there that has any other questions that I hope I didn't miss, or that you'd like to ask before we sign off?
Debbie, it's Lee Rubenstein.
Yes.
I think Albert Einstein would be very happy with Dr. Chan and his ability to explain complex ideas in a very simple and easily understood way.
I agree. Thank you. Great presentation.
Thank you.
Thank you, Ed. And I'm very glad that we were able to split it up between the two groups, because it's a little bit more intimate and offers the possibility of people asking questions on off the cuff kind of thing. So thank you for both presentations. We all really appreciate it. And I have your slides, and we have I will send the video, or I'm sorry, the recording in video form out to everybody, and I'll send it to you too, Ed.
I'm not sure I want to look at myself. Okay.
Okay.
All right.
Excuse me.
Thanks,
See,
everyone.
Thank you.
Thanks for all the
Thank you.
great questions.
Thank you, Dr. Chan.
I don't need
Thank
to
you,
have
Debbie.
cough. All I need to do is laugh.
Oh yeah.
Thank you.
Laughing makes me cough too. Yes.
Yes. Okay. Well, thank you very much.
Thank you.
Thanks
Thank you.
for
That was great.
Yes.